Okay, good afternoon. Once again, I take my mask off when we're speaking so that we can be clearly heard by the public, which of course is the purpose of these briefings. Everybody here in this building is socially distant, everybody wears masks, everybody does the right thing. Our last briefing was on Friday the 23rd. Since then, our total caseload is now 143 cases in Lewis County since the beginning, since March. 72 cases have come within the last week. So in the last week, we've basically doubled our entire total from the beginning of the pandemic in March. Of the 72 cases, 55 of those cases are associated with the cluster that we've been discussing. We have 802 people in Lewis County quarantined. 504 of those people are from the cluster, and of the folks that are quarantined, 154 have tested negative, so that's good news. Currently, as we speak, we have 3 individuals that are hospitalized. Luckily, we have in the last couple days had 2 people discharged, so we're at 3 total, but it's different 3 than what we had a couple days ago. I think the message today is that we need to be very clear that the community is at risk of sliding into one of the state's precautionary zones. In fact, the metrics suggest that we could easily become a red or an orange zone. So that is something that we need to be aware of. We are at risk as a community of having to close schools and businesses. Today we learned that Lowville Academy and Harrisville School District will be going remote for 2 weeks. This is in addition to Beaver River School District that has gone remote for 2 weeks. That means that unfortunately the behavior of our community in the last 3 weeks has led to 3 out of the county's 5 school districts discontinuing in-person education. And I don't think we need to talk about the importance of in-person education because everybody understands, but just to be clear, you know, there are kids that rely on school for more than just education. Kids rely on school for hot meals. Kids rely on school for a safe place to be during the day. Not every child we know is brought up in a loving and safe environment all the time, but when they're at school, we know that they're safe. And unfortunately, because of what has happened with COVID-19 over the last 3 weeks, we now have 3 schools that are unable to provide in-person education. The second thing we want to iterate today is that we do have 802 people quarantined. That means there's 802 people that are contacts of someone who's positive. So to those folks, the 802 that are quarantined, and to the entire community, we need to be very clear. If you are experiencing symptoms, it's critical that you get tested right away. What makes it much more difficult for our team, Ashley's team, is if folks think, well, I haven't been feeling well for a couple days, and then the symptoms escalate, and then we have to contact trace for 4 or 5 days rather than just 24 hours. And that makes a huge difference. Even if you're quarantined, it makes a huge difference of who maybe you've come in contact with. So, that's the message for today. We've got a few special guests with us today, so we're going to try to move through the agenda really quick. But first, our folks at the Lewis County IDA have put together a wonderful graphic for us. They worked with Public Health to put together a great graphic. We've been getting a lot of questions about businesses and essential workers and what it means if you're a contact of a contact, for example. And so Ashley's going to walk us through this graphic here.
Okay. Okay, so part of our case investigation is identifying close contacts. So a close contact is anybody who's been within 6 feet of a positive case for more than 10 minutes. That's with a mask or without a mask. There's also proximate contacts, and those are individuals that have been within an enclosed area with a positive case for an extended period of time. And all of those individuals are required to be quarantined, and that is to prevent the spread of the virus. So these close contacts need to quarantine for 14 days, monitor for symptoms. Some people want to go get tested right away. We recommend waiting at least 2 days because the incubation period is 2 to 14 days. So it can take somebody starting at day 2 to the full 14 days to test positive. The most people will convert on day 7 through 10. So that is when we recommend people who aren't necessarily worried right now and wanting to get tested sooner. That is when we recommend they get tested, between day 7 and day 10, because that is when the majority of people will turn positive if they are going to. And as you can see here, this is how we do the contact tracing. The positive case and their contacts. Now this other layer, the contacts of the contacts are not quarantined. They do not need to quarantine. Yes, everybody, if they know they've been exposed at some level, should practice regular precautions and try and stay away from people as much as possible. That's what we all should be doing: social distancing, wearing your mask, hand washing. But as far as going to work or going to school, these individuals are not under public health quarantine. It is only 1 degree of contact tracing and quarantining those individuals. Let's see here. I think that's about it. And also,
for businesses, if your worker is one of these folks.
Yes, so for businesses, if they're questioning whether or not their employee who is a contact of a contact needs to stay home, they do not need to stay home. They can come to work. And again, I just want to reiterate that the sooner people get tested, as soon as they have symptoms, that significantly reduces the spread of the virus and also reduces the number of individuals that are going to be on quarantine due to going around in the community when they're symptomatic.
Jerry?
Thank you. First, I want to start by acknowledging the efforts of our school leaders, teachers, nurses, and staff in keeping our students safe. They are doing yeoman's work. Your efforts have not gone unnoticed. Let me address testing. We have set up a daily testing program in parking lot 6 of the hospital's main campus, and we have been running it every day. We might be approaching 10 or 11 days at this point. We're going to continue. Today we had an extended hours clinic for testing, and that has worked out well. We are averaging well over 100 tests a day at this point, and we're going to continue tomorrow and Friday. Clinic is from 12 to 1. However, anyone who arrives and is in line will be seen regardless of what time. Regardless of the time, if it's 1:05 and they're in line, or 1:30 and they're in line, they will be seen. So be assured there. We are using the Abbott antigen test that was provided to us by the state of New York, specifically made possible by the governor's office, and I'm appreciative of that. We have gone through the original inventory sent to us. We received an additional 2,000 test kits earlier this week, so we are able to provide the tests. And I will echo Ashley's reflection. If you start to show symptoms, come to the clinic. We are only gathering enough information so public health is able to contact you if you test positive. There's no billing information, there's no charges, no cost. The hospital does not make any money. In fact, our expenses have gone up in supporting these clinics. So that would be my report.
Wonderful. We also have with us this afternoon Randy Lachos, who is a member of the Lewis County Board of Legislators. Randy chairs the Health and Human Services Committee, and we'd like to allow Randy an opportunity on behalf of the Board of Legislators to offer some reflections to the public.
Thank you, Ryan. First and foremost, I just want to thank the folks that are sitting at this table beside me and commend them and their staffs for the amount of work and the amount of effort that has been put forth during this cluster that we've had. And the taxation of our workforce in Lewis County is unbelievable, and these folks have stepped up to the plate and have come out of nowhere, per se, to go through this. So that's the important of us. We have to be respectful. We have to be responsible. Nobody wants to shut this county down, especially the Board of Legislators. But please be responsible. Please be smart. Use your social distancing. This thing is real. And now it's finally, I believe, enough people have been affected by this that we all know someone very close to us that have been affected by this in a very strong way. So please be responsible. That's coming from the Board of Legislators. Thank you.
Wonderful. Thank you, Randy. And I was so captivated by your remarks, I forgot to log in here. What's that? Oh, nope, I'm good. We are going to zoom in with another legislator, Mr. Ian Gilbert, T1FIUD, who is in quarantine himself. And Ian will offer some reflections on what it's like in quarantine. Join with computer audio. Ian, are you with us?
I am. Can you hear me, Ryan?
We absolutely can. Perfect. Can you guys see on there? Connor, is that good? Okay, Ian, I was just introducing you. This is Ian Gilbert, the Lewis County legislator representing the town of New Bremen. Ian and his family are currently in quarantine, like 802 of our fellow citizens in Lewis County. Ian, thanks for joining us. We wanted to just get a report from the quarantine and see how things are going. So first of all, how are you feeling and how is your family?
Yeah, so right now, thankfully, we haven't had any symptoms. I know my wife and two of our oldest kids, they went and got tested at the hospital a few days ago during the clinic. They came back negative. So hopefully, we've had contact with an individual who did unfortunately test positive and needed to be hospitalized for a while. But for our family, at least, it seems like we may not have been hit by it, but we are, of course, staying quarantined according to public health instructions because it's still possible to develop that virus. And actually, we plan on coming in to get tested again tomorrow, just in case we've developed anything since then. But we have been sitting put. We're all doing well, still in high spirits. So just trying to, get through this, weather the storm, and hopefully come out of it okay.
Can you tell us a little bit about what it was like to be tested? Actually, start with what it was like to be contacted by public health and how that whole process went, and then what it was like to go through the testing at the hospital.
So we were aware we were probably going to be contacted by public health because we knew we'd been in contact with individuals who were tied back to that initial cluster. But public health, they called us. They've been absolutely wonderful to deal with. Any questions we've had, we call them. We have a way to reach out to them. They've really, they're giving us wellness checks all the time to check on anybody who might be having symptoms, just to kind of keep tabs on things. But yeah, the initial reach out came from public health. They advised us, I think it was Friday, early evening, that we needed to sit tight. We needed to stay quarantined because of the localized outbreak, but they've been great to deal with.
And what was your experience with the testing at the hospital?
Yeah, so I was actually tested a few weeks ago with my job. I did it at Urgent Care in Watertown. That was several weeks ago. It's very quick and easy. I know for my wife and the girls, we've got, these are our two oldest girls, but, they went through with it. It's a little uncomfortable, but they were, they were tough and they got through it and everything like that. And I know the hospital setup that they had, it was very quick and very efficient. They've done an excellent job. And just to echo what Randy and the others said, they should be commended for how great of a job they're doing. We really appreciate it.
Well, thank you. Last thing, Ian, you're in quarantine. We've got about 800 people across the county that are in quarantine. You're experiencing it yourself. What would be, your message as a legislator to the community?
I would say, just to reiterate what's been said already, we take these measures, trying to reduce our room density, trying to, remember to wear your mask. Remember, when you're out in public, try to avoid unnecessary meetings. We do all of these things so that we can try to do the normal stuff that we enjoy and that we have to do. And, the event that led to the local outbreak, it could have just as easily have been any number of the things that I've been at, where maybe the room density was too large or maybe we weren't all being careful about the masks. And I know at this church in particular, they had followed a lot of the procedures, to some degree, and it could have been a lot worse if they hadn't. But all it takes is one or a handful of people, and you don't always know that you have the potential to spread the virus. So it's just something that we all have to be vigilant about. Even if you don't feel sick, even if you haven't been tied back to one of those initial contacts, remember to wear your mask. Do what and let's do what we can to try to keep our businesses and schools and churches open.
Wonderful. Ian, can you stay with us for some questions in case the media might have some?
Yep, sure.
Okay. Questions?
I know last Friday we kind of left things. You said things were uncontained at that point. Would you say they're contained now, or would you stick with your uncontained?
Well, you guys have had a lot of fun with that word. I would say that we're working towards, getting things more contained. Our caseload, though it has continued to grow, the growth has slowed, right? So, today we've had 7 positives compared to last week. At this time we were, easily into the double digits. So, we're getting closer to having it contained. But what we mean by contained is we know that everybody who's been exposed has been walled off and is in isolation. And that means we are pretty confident that that cluster is not going to continue to spread. At this point, we still cannot say that every contact has been isolated. So that's what we mean by contained or not contained. Ashley, could you expand on that?
Yeah, so we're still obviously identifying contacts or positive cases that were related back to this. So until those really slow or stop, we're still responding to this cluster. We're still seeing how it's impacting the community. So until they stop, it will not be officially contained.
You said as of this afternoon there is now 55 cases associated with the cluster.
Mm-hmm.
Looking at yesterday's report, when it was 52 and we had 63 active cases, are the additional cases connected in any way to each other, or are they more random cases? So we're probably looking at like 15 cases that aren't even associated with the cluster at this point.
So
Are they associated with a different?
No.
Are they more randomized?
They're more random. Yep.
Okay. And when you refer to the cluster, with the church cluster, we know there was also a gathering at the auction. Are they being lumped together in the same cluster because
Yes.
somebody from church went to the auction?
Yes.
So
because
even though there might have
ultimately-
been more people at the auction, when we say 55 cases are associated with the church cluster, that includes the auction as well?
Yes, and I'll tell you why, because the initial cases were identified at the church, and it's grown from there, and it's individuals that were infected from the church that went to the auction. So that's anything that grows out of that, and we can link it back to a contact or is going to be related to that cluster.
I think that's helpful for people because I don't know if they realize that when you refer to the cluster that it means both locations are being counted in the same cluster.
Yep, and so it doesn't actually mean that people had to go to the church to be included in the cluster.
So the 55 people who were at the church weren't, or who are from the cluster weren't necessarily 55 people who were at the church?
Correct.
Okay.
Yep.
And I think on Friday, you had mentioned that there might be other cases associated with the cluster for different counties or states. Is that still the case, or you said you might be able to get us a number? Are there more cases that you're giving us Lewis County numbers?
Correct.
So 55 people in Lewis County.
Yes.
Do you kind of have an understanding of what the cluster looks like overall when you add in other counties?
Somewhat, but I don't have a specific number for you, and I apologize that I did not follow up on that. I can get that number. The state has that number in regard to even cases that have been transferred out of state that are related to the cluster. So that is something that I can get from our regional epidemiologist.
Okay. And as you're going through with people showing symptoms and things like that, I know a question that we've been getting a lot lately, are you guys still doing your flu surveillance and things like that? So when people present with symptoms, are you doing flu tests, strep tests, things like that, or just COVID tests?
So we don't actually do the testing, but primary care providers are still doing their routine, yes, flu surveillance and monitoring those signs and symptoms and testing appropriately.
Okay.
So in terms
Let
of,
me, so Ashley's completely right, but the testing that's occurring in parking lot 6 is COVID testing. Okay, so that is very specific. The visit to the doctor's office or to the emergency department, if they're requesting a respiratory panel, then a whole host of things are tested. One of those would be the flu.
And that's up to the doctor. Your primary care physician is going to determine what tests you need
That is
based on your
absolutely correct.
symptoms.
Yes.
so based on the science behind COVID, we've always known how it was spread. That's why we wear masks and social distance and things like that. From the church gathering, in terms of that science, everyone seemed to be wearing a mask from what we were told from people who were there. But it still seemed to spread. So where does that leave us kind of with COVID in itself, the science behind it?
So the masks,
Anything with science is better for her.
the masks certainly help to reduce the spread of the virus, but they do not prevent it. They are not an N95 mask, which is a respirator that nurses working with COVID positive patients would wear to protect themselves. So while they do help prevent the spread because it is containing the droplets of an infected person, it's not 100% going to prevent it.
And my understanding, they didn't practice good social distancing. My understanding from Lisa Schambach's report that she gave that they had a reception line where they shook hands and hugged. So my understanding with that, with the mask, that kind of threw everybody within a foot of each other or less. So I think that might have contributed a lot to it, regardless of the mask wearing. That's just my Lewis County thought pattern.
And a lot of times at an event like that, there's a shared meal or something like that. Do you know if at that specific event, did they do a shared meal? 'Cause we're hearing that during the ceremony that, yes, most people were probably wearing a mask,
Okay.
but then there were things that happened after the ceremony.
So I think that there's we can play the game all day of what happened at this event. And what happened in our community is because of this church. That is not true. What happened in our community is a series of events where people did not follow all of the required guidelines. Okay? So yes, this cluster began at a church event, but it didn't need to spread to 55 people, and it didn't need to result in 802 people being quarantined. So I think the focus and trying to find blame on one individual gathering is probably not helpful. The fact of the matter is 3 of our schools are closed, and if our behavior doesn't change, all of our schools will close and our businesses. So that is, needs to be the focus, I think, right now.
The question wasn't more of along the lines of like placing blame or anything like that, but a lot of people have read that everybody was wearing a mask at the ceremony, so we've been getting, questions as far as along the lines of, well, then everyone wore a mask, it must not have worked. And I think some details were being left out, if there was a shared meal held during the ceremony and things like that. So that's important for people to know too, because that's going to affect their understanding of the mask part of it as well, if that makes sense.
As I said, the masks certainly help reduce the spread, but they don't prevent it, and they especially don't prevent it when social distancing is not observed.
You said that 3 patients are currently hospitalized. Can you say how many patients are at Lewis County General Hospital, COVID patients?
As of earlier this afternoon, 0.
Okay. So they're all hospitalized somewhere else?
Correct.
Okay.
So in terms of the cluster and the event at the auction house, how do you deter other businesses from doing an event like that if there aren't any consequences?
Well, I think there have been consequences. I don't think any business wants to be the lead story on every single publication in the North Country for 2 days. So the $1,000 fine that the county could levy is frankly nothing compared to the bad publicity. We have spoken with the owners of the auction facility. They have agreed to cease and desist any future auctions at this time. I think the message that our county attorney put out there is that people need to be aware that egregious violations of the executive orders and egregious violations that are putting our public health at risk are things that we will consider fining. We've taken a pretty fair stance, I think, with our businesses. This is a tough time for businesses, and I don't think there's much will of the board to go around fining businesses that are just trying to get by. On the other hand, businesses that are going to selfishly put on events that now potentially cause school children to have to stay home, we don't have a lot of patience for those types of things, and we don't want to take action, but I think that we would reluctantly be forced into a position to have to do something. So Randy, maybe you can talk about, or Ian, talk about the board's position on fining businesses, because I think we've been pretty reasonable about it.
I agree. I don't, I'm going to speak for my fellow legislators, but I don't feel any of us want to see another shutdown like we had before. We need our businesses to stay open. But to reiterate what I said earlier, we just need to be responsible, we need to be respectful, and we need to be mindful. And if someone, just to add on a little bit, if you are feeling the symptoms like Ashley said, don't sit back and try to be a hero and hide it. Go get tested, because it's, we need to keep ourselves up and running, not only for the financial, but also for our our mental well-being. Nobody wants to get shut down again. Nothing could be more fragile than to have to be keyed up. Ian's doing it for 14 days, but what if this goes to 6 months? So I don't think as a board that we would be willing to do this. We're just asking for the businesses and the rest of the community, just like I said, be respectful and be responsible.
When you say, Ryan, that I think you said earlier that we were either approaching or near the criteria for a red zone or an orange zone through New York State, can you just expand on that a little bit about what exactly that would mean for the county, where that kind of takes things out of your hands and puts it into the state hands? Yep. And how are those decisions made? Are they using like a 7-day rolling average of data? Are they using, when will we know for sure if we're going to be placed in those? 2
sets of data that we look at. One is 7-day rolling positivity rate, so all the tests that are done in the county, simple, what % are positive, okay? The second is a geographical measure, which is positive cases per 100,000 population, and that's a 7-day rolling average. And so those are the metrics that we're looking at. We were on the phone with the governor's office before we came in here. I don't know how that decision is made. frankly. But we are nearing those metrics, and we have been communicating with the governor's office, and it wouldn't be surprising if we find ourselves in one of those categories.
Okay. Do you know what the positivity rate is that they're looking for?
It's on the New York Forward website. I don't know off the top of my head. I think it's around 6 right now.
Okay.
Or is
Oh.
this
6.
Is that what our positivity
As a
rate
county.
currently is here? Okay. And then what triggers you going into like a red zone?
Don't know. Yeah,
Pretty close to 7, I
it's
think.
yes, yeah, it's close. It's unclear from the governor's office. Frankly, it's unclear. So.
Okay. Some of the calls I've been fielding this week, especially at the early part of the week, Monday and Tuesday, were from a lot of local businesses. I think I just spoke with at least 8 or 10 of them that aren't looking for like a command from the county or, a demand from the county of what what they have to do, but they just want to be responsible. So they're looking for guidance as far as like, what should they be doing in a situation like this? With COVID kind of spreading in the community now, should they be pulling back on some things? If they can let their employees work at home, should they be, even though they're allowed to let their employees into work, should they let them work at home if they can? Like what kind of things would be responsible for businesses to do right now?
So certainly following all of the guidelines to a T would be absolutely something that we have recommended this entire time and will continue to recommend. Obviously, any chance you have to reduce contact among people is a good thing from a public health standpoint. But at this point, yes, we do have 55 cases, but it's not something that's going to come from the public health department that, you should be shutting your business down right now. Those are decisions that are made with the state, with the county leadership, but from a public health standpoint, any opportunity to decrease exposure among people is a good opportunity.
And when you talk about the incubation period of the virus being about 14 days, if people did pull back over the next 2 weeks, could that have a large impact on
Yes,
bringing, containing the outbreak?
it could, yes.
Okay. And the other question is, obviously Halloween's on Saturday. Tons of people have been reaching out, asking what should they do for Halloween. Not what can they do or what are they allowed to do, but what is public health's guidance on what should you do to keep your family protected?
I believe we have shared on our Facebook page the guidance from the New York State Department of Health. And if we have not, then I will make sure that gets out there as soon as possible and also post that on our website so that the people know what the State Health Department is recommending for Halloween.
So you think it's okay for people it's safe for people to be trick-or-treating and things on Saturday?
Our position is the state's position.
Which says it's okay, right?
The state says it.
Says it's not okay. So no trick-or-treating.
No.
Okay.
I have a question.
The people should go on the county Facebook page, look at the guidance for themselves.
Okay.
It's very specific. It's a themed orange and black with spiders and pumpkins from the state of New York. It's good guidance. And frankly, there is a role for towns and villages in some of this stuff, especially with local trick-or-treating. I think they need to take the lead and take a look at that for their communities.
Okay.
I have a question in terms of contact tracing in schools and things like that. Obviously, that can get extremely difficult with students and then they go home to their families and things like that. Are we at the point with contact tracing and just with this virus where you guys are going to start advocating for maybe shutting down schools in Lewis County?
So we work with the school for contact tracing. All of the school staff from the New York State Department of Health are considered non-essential because the schools do have the option to go remote. So obviously when there's multiple cases within a school, a lot of teachers are quarantined. That makes it very difficult to hold in-person instruction. So we do work with the schools on what is best for public health, but as far as public health saying you need to go remote. We are not in a place where we are doing that at this point.
Okay. What would you, if you had to do that? I know it's kind of up to the school district and then ultimately up to the state if you guys were to hit that metric, but if you were in between those two, would you guys be in a place where you would close down schools? If need be.
So I think we got to be very clear here. The Department of Education has jurisdiction over schools. The county government does not have jurisdiction over schools. We have a very strong working relationship with the school superintendents that allows us to communicate and help everybody to understand what's happening on the ground. The reality is we have small school districts, and it only takes a few bus drivers, a few cafeteria workers, a few instruction teachers to shut down an entire district. In terms of an order to shut down a district, meaning that the district themselves didn't make the decision, but the state is telling them to make the decision, that would not come from the county. That would come from the State Department of Education.
I should have said advocate for. Is that something you would advocate for in the event of?
No. I think we would, our position is if we can keep our schools open safely as long as possible, the more in-person instruction we can offer in Lewis County, the better.
In March, the county had moved to reduce capacity in the building, had a number of people working from home and things like that. Is that something that you're considering doing now with the current situation, or is everything fully running here at the county right now?
We have had a policy. We adopted a telework policy probably 3-4 months ago. The Board of Legislators adopted a telework policy. We have had increased flexibility since the beginning of the pandemic, even when we allowed people back. If folks are able to work from home, we've allowed a little bit more flexibility for that to happen. So we've already taken some measures to reduce density in our buildings. But right now we are at full staff, and frankly we need to be at full staff. We are pulling employees from every department. Planning and real property tax were answering phones at public health yesterday. Caseworkers at DSS and probation officers are doing quarantining. My whole support staff in our office got trained in quarantining today. So we are all hands on deck in Lewis County, and we're doing everything that we can with every resource that we have, including personnel, to assist public health.
I think my last question is just in terms of, there is a holiday, I guess this weekend. What would you say to community members who plan on throwing a big event, or even businesses that throw a big event? What is your message to them?
A big event?
Just some sort of any event, like ones that we've had related to this cluster.
Yeah. Big events are a very selfish idea right now. Very selfish. To reiterate, we've got kids that aren't going to receive in-person instruction because of where we stand right now. Anything that exasperates that situation is a very selfish act. And Randy, Ian, do you guys want to comment on that? Last word, we'll give the legislators our last word, then we'll wrap up here.
Go ahead, Ian.
All right, I'll reiterate just what Randy said before. I think we've had success in Lewis County for a long time. Obviously, we have, geography on our side. We're a very sparsely populated county. And also just that, for the most part, I think people in this county have cooperated. They understand the stakes. They understand what they need to do. And our board really all along, the best protection in this whole crisis is personal responsibility. Everybody needs to take responsibility for their own actions. You need to know you don't live in a vacuum. Your decisions have an impact on the people around you. And liberty, properly understood, it carries with it certain duties that we have to our neighbors, to our public, and to our community. So that's the point that I would really emphasize. Think about how your actions impact the people around you, and follow the guidance that the county is giving you. And again, just to go back to what I was saying at the beginning, if you feel symptomatic, call public health. And then when public health tells you to stay quarantined, stay quarantined. You can test negative at one point and then positive later on. It's very important. They understand the big picture. They see the big picture. Let's get through this. Hopefully we'll be able to look back at this in a few weeks and understand that this was an event that was limited in time and scope. But that's going to depend on all of us redoubling our efforts right now.
Can I ask one more question about testing?
Sure.
Okay. Just maybe this is for Jerry because you run the testing site there at the health center. Are you seeing unsolicited people coming in to get tested for COVID, or is it mostly just people that are showing symptoms or have been recommended to come in because they think they've been exposed? And is it helpful to have people that aren't experiencing symptoms or don't think they've been exposed to come in too to kind of draw the positivity rate down?
I wouldn't frame it that way, Nick. I would say anyone who is concerned at any level should come and get tested. There are some folks that public health has specifically asked to come to the clinic, and there are individuals who fall in the various stages of contact, and then there are individuals who are simply nervous. They are all welcomed, and we encourage them to come. It's not about driving a positivity rate. It's really about containing by knowing who is positive. And if we know that early enough, then I think this becomes a 2-week challenge versus a 2-month or 4-month challenge.
Thank you.
Thanks, guys. Appreciate it. Thanks, Ian.